Welcome back to the Healing Wellness Show, where we actually are going to dive into the latest breakthroughs in natural healing, and that's also regenerative medicine and holistic health. I'm your host, Dr. Karim, and today we're actually going to be diving into one of the most exciting advancements in regenerative therapy, and that's SoftWave Therapy, also known as Shockwave Therapy. This cutting-edge technology uses acoustic sound waves to activate your body's natural healing response. And that also improves with circulation and also helps with regenerating tissue. And that's without surgeries or downtime. And today, joining me today is our guest, Dr. Matt. He's the founder of the Atlanta Pain Institute. He's also an educator and one of the leading experts in sound wave technology. Dr. Matt not only treats patients with SoftWave, but he also teaches other doctors just like me across the country and how to use this machine effectively to change lives. So, Dr. Matt, I'd like to welcome you to the Healing Wellness Show. Why don't you tell us a little bit about you and your background?
Well, thank you, Dr. Mo. I've been a chiropractor for 31 years. Graduated from Life University in 1994. It sounds like a long time ago, but I still feel like I'm 18, I tell you. Chiropractic and SoftWave have kept me young, both physically and mentally. I've been married to my lovely wife for 33 years. We have 3 wonderful daughters, Isabella, Emma, and Analia. I actually helped bring SoftWave to the chiropractic profession back in 2017. I like to say I'm not the smartest guy in the room, but I do see trends before some others. And I think that's how we were able to bring this amazing technology to our profession.
That's awesome. Before we get into the SoftWave, how did you get into healthcare and pain management?
Great question. I was an athlete first. And as early as junior league football, my dad and mom started bringing us to chiropractors. And I played high school lacrosse and football, and I got injured my senior year of high school, couldn't play the last 2 games. Chiropractic helped me recover, but I picked lacrosse to move into playing collegiate sports, which saved my neck a little bit. But I was injured my junior year. I was scheduled to have surgery on lower cervicals, and my older brother, Joseph, he was graduating from Palmer, and he opened up in our hometown, and this is like November of 86, and he started working on me for like 4 weeks prior to my surgery, and I did so well that I was able to avoid surgery. It was an amazing thing, and I was in pre-med. So once it fixed me, I remember going to my neurosurgeon, Dr. Joseph Mann, and he was like, well, surgery's going to be on this day and this day. I'm like, Doc, I'm doing so much better. Look at my arm and my hand. I can move it. And he's like, what happened? And I go, I was going to a chiropractor. And he said, I've never seen a chiropractor work for anybody. And I was like, let me be your first. So I remember the reason why I searched for an alternative is because at my pre-surgery consult, he told me, I said, how soon can I get back on the lacrosse field? And he said, oh, you'll never be able to play contact sports again. I'm like, what? I mean, the only reason I went to college was to play lacrosse for 4 more years.
That's terrible.
I was lucky enough to avoid surgery and quickly enrolled into Life University in 1990, 91, and, had such a great experience down here.
That's awesome. Thanks for sharing.
Mm-hmm.
So what first sparked your interest with the SoftWave therapy?
Well, I mean, I practiced for 12 years up in New York. I had 2 clinics in central New York, and I was seeing 280 to 320 people a week. I was rocking and rolling. I was one of the top doctors in that area. We did, 40, 45 new patients a month at that time. And I was rocking and rolling. And in August of 2006, I had a 350-pound patient fall off the table, and I grabbed him. It dislocated my shoulder, tore my labrum, sprained my ligaments in my wrist. And I went from who's who to who's that to who cares in healthcare. Because I was out of work for 3 years. I had to have 2 surgeries. I ended up selling my business to my associate doctor, and I retired back here to Atlanta, where my wife was from, and we raised our 3 daughters. I started teaching at Life University. I taught there from 2007 to 2009, and it gave me time to really focus on my own recovery. And I worked for the functional rehab department. I was the co-director, and we had cold lasers, ultrasounds, dry needling. Nothing helped my wrist. My surgery on my shoulder was a 99% success, but my wrist surgery left me in pain for a decade. And it was a constant pain of 5. And I could not do any type of wrist extension for 10 years. So I couldn't adjust. I couldn't ride a bike. I couldn't push a lawnmower, thank God. I couldn't swing a golf club. And I'd lost my superpower of being a chiropractor, right?
Yeah.
And I went, I searched the world for some type of relief. Cortisone injections didn't touch it. I wasn't one for prescription medications. It was just masking the pain and the symptoms. And the funny thing is, my wife went to high school with the CEO and founder of SoftWave, and my brother-in-law wrestled with him. So
wow.
like 9 years ago, he dragged me up, and I remember going in to see this guy, John Warlick, and he said, "Is there anything on your body that hurts?" I'm like, "Yeah, man, I've had this pain in my wrist for nearly a decade, and I can't do this, I can't do that." So he goes down, he does a 3-minute treatment on my wrist. And I was hooting and hollering. He kept saying, "The more pain you have during the treatment, the better clinical outcomes." And so I sucked it up, and for 3 minutes, and when it was done, I was like, "Dude, where's my pain?" Like, I couldn't elicit it. This constant companion that I'd had for over 10 years was gone. And I was like, geez, how long is this going to last? I remember calling my wife on the way home. I'm like, this must be a placebo. And she's like, why? I go, because I can't trigger that pain. For 4 days, I was pain-free, the first time in 10 years. I went and hit a bucket of balls. I went and rode my bike that weekend. I got another treatment on Tuesday, got another one on Friday. After 3 sessions, I was 90% better. I bought a device, and I didn't have to treat my wrist for another year. And I could have done it every week, every day, but I didn't need to. And I quickly realized, like, this has to be everywhere. And I bought distribution rights for all chiropractors in September of 2017. And I thought, like, oh, this is going to be easy. I'm just going to call my buddies and they're going to buy it, right? Well, guess what? The first 11 months, I had 110 doctors tell me no. They're like, DiDuro, if this is as good as you say it is, why isn't it everywhere? I'm like, yeah, that's what I'm trying to do, right? So I had it in my clinic. I saw what it was doing specifically for neuropathy patients. An average neuropathy patient that came in was a pain level of 8. And quickly after 2 or 3 sessions, it cut their pain in half. But more importantly, what used to take 24 sessions over 3 months, we're now treating that same case with 12 visits over 6 weeks. So we cut visits in half, we cut time in half, and patients went from a 20% improvement to nearly doubling to a 35% improvement. So in half the amount of time, half the amount of visits, they were getting nearly twice as improved. So then I started sharing that information and putting them in some of the top neuropathy clinics around the country. And then they told 2 people, and then they told 2 people. And I think the first 5 years, it took us, we sold 1,000 devices. The last 2.5 years, we sold another 1,000 devices. So we've doubled in half the amount of time for SoftWave.
That's awesome. That's awesome. So for those hearing about SoftWave for the first time, can you explain, like, in simple terms, what it is and how it works?
Absolutely. So this is genuine lithotripsy. So it's the same technology we've used for over 44 years to break up kidney stones, biliary stones, and salivary stones with an 85% success rate. And mind you, when this came out, it revolutionized the way they handled kidney stones. Prior to 1980, you would have to do surgery and go retroperitoneal through the back and find that little vessel that had the stone in it and pull them out. There was a high risk of infection. There was a long recovery time and a high risk for infections, right? So this was non-invasive. It uses what's called electrohydraulic, which there's a spark plug in the middle surrounded by water. So it's electrohydraulic. And to be a true shockwave device, you have to elicit waves that are traveling over 767 miles per hour. That's the speed of sound. Ours is nearly hypersonic. We're 4.4 Mach speed, and it's 3,355 miles an hour. So it can penetrate the depth of a soup can into the body, which I love to show. This is a good example, 10 to 12 centimeters. And it's working on a cellular level. The beautiful thing about SoftWave is we've been around for over 21 years. We have over 200 peer-reviewed studies. We spent over $25 million in research and development. And we have worked with over 98 universities globally. So
Wow.
we're not some one-hit wonder. And you're starting to see a lot more shockwaves coming on the market, correct?
Yep.
It's getting confusing. My bottom line is I'm a clinician first, right? For the patient. And that's why I brought this into my office. And when I saw how it literally accelerated the way the patient healed, I was like, I mean, people need to have this as an option, right? Because currently the standard of care is opioids, cortisone injections, surgery, joint replacement. I've had patients that are 38, 39 years old who are recommended, knee replacements. That's way too early in life. So this has been very consumer driven. I remember when people didn't even know what SoftWave was, but now over 50,000 patients visit softwaveclinics.com or find a SoftWave provider near me every month. Close to 600,000 consumers are searching for that.
That's awesome. So you kind of mentioned that there's other devices out there. So what's the difference between a SoftWave and other Shockwave machines, or say laser therapies or anything like that?
Yeah. Great question. And there's some devices that Stort's, very reputable company. They have like a metal tip on the end. They are ballistic in nature, and that metal stylus pounds on tissue, and it might have a circumference of a nickel of the treatment area, but it actually damages tissue. It creates what's called cytotoxicity, and it's only going superficially, maybe 4 or 5 nickels into the depth of the tissue. So there's great trauma. Ours, there's no trauma. We use mechanotransduction. That's using the electrohydraulic sound waves to help trigger a biological effect without damaging tissue. So we have cardiologists that use this during open heart surgery. We have urologists that use this on men's and women's issues. We have neurologists that are using it, orthopedists that use it during surgery. Probably the most famous one here in the States is Dr. Martin O'Malley at the Hospital for Special Surgeries in New York City. He's phenomenal. I give him credit because in 2014, he was the first to bring this technology into sports medicine.
Mm-hmm.
And he's the consultant for the NFL, the NBA, and he's a foot and ankle specialist for the Knicks, the Nets, the Giants. He works with some of the most amazing teams and players. And he has 3 of our devices. And I love what he says. He says, hey, I'm not here to debate who's got the best Shockwave device. All I can tell you is I have 3 of these. And that's it. Drops the mic. Boom. Right? And he can. So we've been lucky enough to, hear us speak and chat with our other professionals and also talk about the protocols that work for like a non-healing tibial plateau fracture or shin splints or turf toe. I've never seen anything work better for those 3 conditions, or chondromalacia patella. That's where the patella is not tracking. And Michael Jordan made that condition pretty famous because he would wear the neoprene knee sleeve with the hole in the middle to help that tracking.
So how do these sound waves help stimulate the body's natural healing mechanism?
That's great. I mean, that's a great question. Of those 200 plus studies, there are 30 of them that show that we're working with the innate immune system. Now, you can call it universal intelligence, you can call it God, you can call it the body's innate wisdom. And basically what happens is your body is a self-healing, self-regulating, self-maintaining organism. So if you cut your finger, right, and it's bleeding and you wipe it off and you put some iodine and Neosporin and wrap it in a Superman Band-Aid, in 7 days when that falls off, guess what? It's healed. Now, what healed it? Was it iodine? Was it the Neosporin? Was it the Band-Aid? No, it was the body, right? And sometimes the body needs a little help when it comes to healing. So what these are showing, what these research studies are showing is that when the body is injured, there is these first responders that come to the injured site. So it could be like interleukins, cytokines, but specifically toll-like receptors 3 and 4, which are essential for healing and modulation of inflammation. And Dr. Johannes Holfeld, who's that famous cardiac surgeon who's done over 63 bypass surgeries and then used our patented technology during open heart with a side-firing probe right on the left ventricle and showed a 12% improvement and overall left ventricular function. And that was just recently published in European Heart Journal. And, that was 1 year later. And they showed basically a 33% improvement in the heart function of these people who had both bypass and SoftWave. Now, why is that important? Because never before in the history of mankind has there been a true regenerative cellular type of therapy to heal.
So how quickly would you say patients start to notice improvement with these treatments?
Well, that's funny you asked that. Let me show you this one. Who's that guy?
You found it, huh?
Yeah, I found it. So it's near immediate relief. And this is you after.
Let's see the real test. Why don't you do a burpee? I need the. You need to wait. There's a weight room right down here. Let's go. Do a push-up. Do a push-up. No? Really? Push-up doesn't. Percentage of most is usually with the weight. Okay, we'll find out.
So most people notice it within minutes. Let me show you one that's got over 225,000 views since, I believe, Tuesday. This is us at Syracuse University, and this is the young man that we worked on. His name is Carmelo Anthony's son, and he's a freshman.
First, you're kind of spreading the gel.
This has over 225,000 views, and you see his reaction.
What's the pain level like now? Like a 4. Yeah. So almost cut it in half, and that's what we're looking for. That's one session. Thank you. Man.
So, that's why we're in 38, 39 professional sporting teams. LeBron James uses this before games and after, per Dr. Martin O'Malley. And during the playoffs, he used it at halftime because it literally helps modulate or downregulate inflammation, which is really the true source of a lot of pain and discomfort for our patients that we see walking in and out. Inflammation.
That's awesome. Yeah. I did use the device multiple times when I saw you, and yeah, I had problems shoulder wise when I was bench pressing, and I met you. It was a seminar, really. So I did I think 2 or 3 sessions, and went in on Monday, got back, started bench pressing. I was like, oh yeah, pain's gone. So
isn't that
yeah,
cool?
I do believe
and again, healing takes time. So this isn't like biblical healing where we wave this wand in front of you, right? But what it is futuristic, and it reminds me so much of like Star Trek. If any Trekkies are out there, but there was a tricore medical scanner, and Dr. Bones would Captain Jim would be passed out on the table, and they would beep, 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 beep. They would wave this thing over him, and all of a sudden they would pop up, right? So I like it. In 31 years of healthcare, I've never seen anything that is more versatile, because when we go to these international Shockwave symposiums, there are doctors from all over the world, 325 doctors at this last one. There's cardiologists, urologists, neurologists, orthopedists, physios, chiros, acupuncturists, all of us there kind of presenting our research on some of the toughest cases in our verticals and how well they do. So not only is the most versatile thing that I've seen in our lifetime, but it also might be the safest and most effective. The FDA labels this as a non-significant risk factor because there's little to low side effects. And quite frankly, there's low downtime. It doesn't cost the patient an arm and a leg. And again, I am all about regeneration and healing and natural. Our doctors, we have this saying, we're on a mission to end pain and suffering for millions of people without drugs, cortisone injections, or surgery. And today, we have 2,600 doctors strong across North America. Every day, tens of thousands of patients are getting this natural option to help them solve their problems. And what does this work on? It works on anything ending with itis, right? Which is inflammation. So could be bursitis of the hip. It could be plantar fasciitis of the foot. It could be epicondylitis of the elbow, carpal tunnel, arthritis, intercostal neuritis. You can go to my YouTube page, Dr. Matt DiDuro, and just see what I've been doing over the last 7-8 years is just posting transformational videos after one session with this thing. Just one.
That's awesome. So is there any conditions that you wouldn't use this device on?
Great question, Dr. Mo. Yeah, there's 3 tiers. Tier 1, we'd never put it over fetal tissue or the abdomen of a pregnant woman. We would never put it over an active tumor or cancer because it helps increase blood supply so much, which is called neovascularization. And then tier 2, we stay away from left shoulder or pec of someone who's had a defibrillator or pacemaker. And then we wait 21 days after they've had a cortisone injection. Because do you know cortisone has 33 negative side effects? A general surgeon will not cut on a patient that's had cortisone. They have to wait 3 months because it decreases your immunity. It decreases how your body heals, right? And if you look in the big picture, right, if you weighed things, there's certain conditions that lower or weaken your immune system, right? Like smoking, like drinking alcohol, like being overweight, like being diabetic, like being on immunosuppressant drugs because they have a kidney transplant. Those all weaken. What strengthens a body's immune system? You know, good sleep, good exercise, eating right, keeping your weight at a proper level, yoga, those type of things, right? But this device is the great equalizer. And I have to tell you about the Austrian healthcare system 20 years ago, literally tested all the different Shockwave devices and found that this one got more significant changes after one visit than any other Shockwave. And that's why they have it in 11 trauma centers. And over the last 20 years, estimate that we've saved them 70 million euros on non-healing fractures and non-healing wounds, right? Because there's an antimicrobial and antibacterial effect. What do non-healing wounds and non-healing fractures turn into? Amputations, right? So we have saved thousands of amputations already in Europe, and we're starting to see that trend here in the States as well.
So you can use that on a wound that's not healing?
Absolutely. Some of the best cases I've ever seen. I can
Wow.
pull some up and show you. Not that I'm a wound specialist, but I practice in a multidisciplinary clinic with medical doctors, nurse practitioners, and we've taken care of infected dog bites, spider bites, snake bites, and just wounds, right?
That's awesome. So you touched base a little bit about FDA. So is this device FDA approved? Because a lot of people, that's usually one of their biggest questions. And if it is it for specific conditions?
Right. So most FDA approves drugs and clears medical devices. So we have both class 1 and class 2 cleared. We're one of the few Shockwave devices in the world that has both of those. As of January 2022, we are cleared as a class 2 device for wounds, diabetic ulcers, burns, and post-surgical scars. So medical doctors are literally billing Medicare and getting paid for this up to 6 visits. Yes. So it's very, very good. And, you know, I like the fact that there's a diagnostic component with this. You know, most of the stuff, 95% of what we're doing is more musculoskeletal or chronic arthritis, that type of conditions, or nerve degeneration. And we have over 48 patents, one of them being for elongation of neurotissue or peripheral nerve regeneration. And that's one of the reasons why I brought it into my neuro and neuropathy clinic so that we could help more people.
Awesome.
Mm-hmm.
That's that's really exciting stuff, especially for docs that you said, work on neuropathy, because they're always looking for different solutions.
Yes. You know, neuropathy is a very debilitating condition, and there's no cookie cutter recipe or answer for it, right? Each person is unique in their own way. But I will tell you, the protocols that we've developed with this device and with my brother, Dr. Joe DiDuro's Neuropathy Treatment Center's protocols, I believe we found the most efficient and effective way to take care of these people. And I will tell you this, Dr. Mo, and I know you're like me, but in 31 years of healthcare, I've never heard a patient say, I want more expensive care, right? Yeah. There's healthcare since I graduated in 1994. Every year, insurance has double-digit increased. Deductibles, I remember when it was a $100 deductible and I had a $10 copayment. Forget it. They're $10,000 deductibles, $50 to $75 copayments, right? And again, I'm not here to bust on our healthcare system, but it is broken, especially the insurance model. Medicine has become an industry in this country, and it's ridiculous. It should be a God-given right to have healthcare for whichever country you're at, and we just don't have it here. And And I know you could probably enlighten us as well. You've seen it over the last few decades that you've been working, but this thing gets people better fast. You need a handful of sessions, and the diagnostic component is what blows everything else out. Because if you come in and you've got a bad shoulder and we map out that area and we can't elicit any hot spots or trigger points, you're not a candidate. But on the opposite end, if I work on your shoulder and you're like, oh, the more therapeutic discomfort you have during this treatment, the better clinical outcomes. It's as easy as that. And if they do well after one session, they're going to do well after there's a biocumulative effect. So they'll get better and better. I want to show you this one that we just did. Not only do I help sell, but then I also help train hundreds of doctors every month. But I also specifically have flown out. So I've sold 900 of these over the last 7.5, 8 years. I've trained close to 400 of those clinics where I literally got on a plane, flew to that location, spent 4 hours, and saw between 10 and 12 patients for their launch day. We average about $5,000 in that first 4-hour shift. And if you look at the 400 clinics that I've done, I mean, I've helped generate over $2 million just on their launch days for those 400 clinics. On average, a doctor who is in a very, has 50 to 75,000 people in a populated area, they can do very well financially. And not only does it stabilize your clinic, but it gets your patients better and you become that draw in your community. Like how did Matt DiDuro, dyslexic, ADHD, barely got through chiropractic college, how did I become a consultant for the Miami Dolphins, the Dallas Cowboys, the New York Mets, Syracuse University, University of Houston, Orlando Magic, Sacramento Kings? Because I have this device. That's why. And I knew where to put it and press the button to turn it on. Like I have this saying, and I want my patients and my doctors to understand this. Take no credit, take no blame, right? The body is the amazing healing machine that gets the credit.
So you touched on teaching. So you're known for teaching other doctors about the SoftWave therapy. What inspired you to start doing that?
Well, first, my own injury, right? And on my podcast, Free My Pain Now, you can hear my story and my wife's story, but you have to be your own healthcare advocate. And my wife, God bless her, of 33 years, Sherry, she's an 11-year cancer survivor. She had breast cancer and diagnosed, 11 years ago this month. And I saw how terrible the 4 months of chemotherapy was. Every 2 weeks, she would go in and the chemo nearly killed her. After her second chemo infusion, she got neuropathy so bad that she couldn't hold a metal fork. She couldn't brush her own teeth. She couldn't button her clothes. She had to wear slippers because none of her shoes fit because her feet were so swollen. And we had to create, necessity is the mother of invention, right? And this is where we had to create some of this protocols to help her survive, right? And then learning from that has made me somewhat of an expert in chemo, diabetic, and peripheral neuropathy. She's also a type 1 diabetic. So, it's like, first and foremost, I got this for myself and my family. Secondly, we got it for our patients in our community. Again, my clinic, I built $1 million clinic with SoftWave during COVID. During COVID, in September and October of 2020, we were seeing 140 new SoftWave patients a month. I had myself and 4 other chiros, and that's all we did. And even, 5 years later, we're still the number 1 SoftWave clinic in the Southeast, but there's now 75 other devices just in Atlanta. You can see where it's doctors, they want to jump on the next bandwagon. They want to be on the next hottest thing. This is not going anywhere. I have said this for 8 years. There's going to be 2 types of clinics in the future. Those who have SoftWave and those who don't. And the ones who don't are going to be antiquated like a flip phone from 2008.
So what are some of the biggest misconceptions or mistakes that you see providers make when they first start using this technology?
Well, the first one is sticker shock, right? They start looking at these devices and they're like, oh my God. Most of the doctors are my age. They're, been out practicing for 2 or 3 decades and they have stuff paid off and they don't really want to go into debt. This is a large investment. It's like buying a Porsche. Now you can buy a low level Porsche, or you can buy the turbocharged with the fin thing, right? But we help you find which device is best for your community. And the coolest thing about it is this device, the majority of my doctors are able to pay this off in 110 days. So it becomes the golden goose. It's like this gift that just keeps on giving, and every day it should plop out a golden egg that's worth about $1,200. But the biggest mistake that doctors make is they go into Google, boop, and they put Shockwave, right? And the next thing you know, they click on something that's an actual ad, and they start talking to a slick salesperson. And any type of new billion-dollar sector that's emerging, you're going to have some issues, but there are more and more predatory behavior in this emerging sector because so many doctors think that this is the next gold rush. But what ends up happening is it becomes a gold flush for them because they buy $50,000 or $60,000 and they buy the wrong device. And those salesmen, it. We have PTSD from dealing with these salesmen who promise the sun and the moon, but it never really lives up to the expectations. This is the first device in over 3 decades that exceeds expectations. And it seems like every 2 months, we find another condition that can benefit from SoftWave. So be careful who you let in. And I have a provider's guide to Shockwave Therapy, which I just love because you ask the right questions, right? What is the maintenance? For us, at the end of the day, you push a button, you drain it, and you turn it off. Other ones, you have to unscrew the top. You have to flush out the water. You have to make your own salt mixture and put it in. It's a joke. It's like having your own little chemistry set or Easy Bake Oven. So, and a lot of these other groups, and I'm not going to name them, but they end in wave, but they're all trying to be the next SoftWave. They probably would have done well if they came in at a good entry level point, right? Because they're buying these things for $10,000, $11,000 in China and Turkey, and then marking them up to $60,000 or $70,000. Mm-hmm. And when I ask some of the guys who are competitors, I ask, why would you do that? Well, you guys are charging $70,000 or $60,000. Why shouldn't we? Well, we have 26 years of track record of building lithotripsies and SoftWaves, right? We've spent over $25 million in research and development. We have over 200 studies. You have Shingatsu, nothing, right? Zero papers, zero track record. And that's why I always say we're not some one hit, wonder. You know how those songs come on? Come on, Eileen. The Dixie people, that was their one good song, right? But we all remember it. So yeah, Mo, you can tell I get passionate about this, man. I love it. I love the best thing is the predictable patient outcomes and what we see in our office. And I just want to share that with more doctors, right? Because that's why we got into this. We are healers. We want to help people, and, I can't wait to place this in your office because you're going to see the difference. I have for 4 doctors a month. And this is for you doctors out there, I will have a 60-day guarantee. Money back. I'll take the device back if it doesn't work. I'll put it in your office for 60 days. If you don't see phenomenal results and don't take videos like what I was showing you, I'll take the thing back. You don't deserve to have it if you can't find the right spots. But that's what I'm going to do for the next several months to make sure that I find the top doctors in the United States and Ireland. If you're in Scotland, if you're in Norway, we're coming. We want you. We need you to help us on this mission.
So is it in different countries right now?
There's about 3,400 worldwide. 2,700 of them are in North America, US and Canada. But we're 95% of the market. Slowly, socialized healthcare system. In Europe, they might only do this once every 3 months on you. Right? Because you have to get in line and rotation. That wouldn't work here in the States, right? Time is money. People want to get better. And I created what's called the less is more protocol, which is basically microdosing this very powerful, intelligent energy into the body in a good way so that we don't overload the nervous system, that we don't overload the pocketbook, right? They shouldn't have to trade their pain and suffering for a financial pain and suffering. And that's where we've had this wonderful marriage to bring this to the masses. And chiropractors tend to be the best providers. I was going to tell you, I believe, stem cells and regenerative medicine is the future of healthcare. But right now, it's the future for professional athletes, A-list celebrities, and multimillionaires. because they're the only ones that can spend the amount of money. And it's really, it's somewhat of a crapshoot. Some of these patients get better and some don't. It's not a totally figured out industry yet.
So how do you approach training for doctors, not only to understand the science, but to, how to communicate it to the patient?
Dr. Mo, some of the best questions. And by the way, I did not see any of these questions. But what I teach my doctors is like, listen, I'm not teaching you to talk just to your patients. I'm teaching you how to talk to the world. Because guess what? How did we get in the SU basketball program? Well, one of the assistant athletic directors went to one of my SoftWave providers up there, Dr. Tim Del Medico. He did such a great job with him. He said, we should get this in for the students. Next thing you know, we're demoing, boom, they got a device, So that's the way it is. The most beautiful, the beautiful thing about what we do at SoftWave is not only do I help sell and coach you for those first 2 months when you get it, but I'm also going to fly out and help you launch this. And I asked the doctors, can you line up 10 to 12 of your worst people, not only in your practice, but in your community? I want people with bone-on-bone knees, failed back surgeries, plantar fasciitis that hasn't gotten better, non-healing fractures, shoulder issues, carpal tunnel, bone-on-bone knees. Get them. I'm like the Statue of Liberty. Like, send us your tired and your poor patients that aren't getting better. They've been to doctor after doctor. And then we line them up every 15 minutes. And over 3.5, 4 hours, and I tell them, have somebody that's filming because you're not going to believe it. You want to document it. And we show them over that 3.5 to 4 hours, just how this not only can transform your practice, but your community. And you will refer out less, take care of more difficult cases, and you will become that beacon, that magnet to take care of more difficult cases that don't want to take opioids. I mean, Dr. Mo, we just finished this pandemic, right? COVID. For the last few years. But we can't forget about the epidemic here in the States where opioids overdose, we lose almost 1,000 people per week, every week. That's 60,000 per year that are dying from prescription drugs and opioid and fentanyl overdoses. If we were the FAA, they police themselves so much. Like if one Boeing jet goes down, they will land all of those planes until they figure it out. But every day, every week, it's like 3 jumbo jetliners going down every week. And for some reason in medicine, it's like, well, that's the price of war. Yep, we missed that one. And that's a sad part of how medicine has become an industry, how vaccines, right? If you get injured by a vaccine, and we all know somebody, you can't sue the drug maker that made that vaccine. Isn't that crazy? Oh. Now, I know RFK Jr. is in a position there. He's going to make America healthy again. And some people don't align, but I think he's on the right course. You know what I mean? And you know it. And he's very pro chiropractic and, letting the body heal.
Holistic in general.
Yes, absolutely. Yeah.
So what do you find most rewarding about mentoring other practitioners?
I just think that, Josh Axis, Dr. X, I like what he said to me. He said, because I was part of his mastermind group when I was kind of reverse engineering this 7 years ago before I even had 2 or 3 doctors who had bought. But he saw what I was doing in my clinic. And then, a couple of years later, he said, DiDuro, you're not just a thought leader, you're a result leader. And I go, no. I have ADHD. I'm dyslexic. Yeah. I can't get anything done. He goes, no. You've been able to scale this now to over 2,000 clinics that are utilizing the protocols that you developed in your little brain and clinic in Atlanta. And I sat back and I said, dang, that's how you make an impact. And, I think we're on this earth for such a small little time period, a blip, that if we can make it a little better place before we leave, I think the eternal impact of getting this to over 2,000 clinics is what I'm most proud of, other than my 3 daughters and my lovely wife. I think that long after I'm gone, that will still, history may not remember me, but my family, my friends, and my colleagues know how hard I worked over the last several years to make sure that this became just SoftWave it, right? Mm-hmm. So it becomes a verb at some point, and people are like, you should get that SoftWaved. And that's where we're going to. So again, I stand on the shoulders of so many of these doctors and engineers and physicists from Germany that really created this. And the Germans have this saying, less is better, right? It's a very simple formula. I mean, you look at German engineering and some of the cars they make, and this is just, it's beautiful. The brilliance is in the simplicity.
That's true. True. So, are there any new applications or research areas out there right now that excites you about using SoftWave?
Yeah, really, there are. You know, we're already at Mayo Clinic, Cleveland Clinic, Yale, Harvard, MIT, University of California, San Francisco, and San Diego, Baylor University, some great teaching institutions. But there's a Dr. Max Toya in Germany, and he's a professor, and he's doing some really cool research on cancer. And at first, they were using SoftWave as what they called the Trojan horse to get these chemicals inside the tumor and inside the cells. And all of a sudden, they start realizing like the cancer was pulverized. And they thought, okay, was it the chemo? Was it the SoftWave? And SoftWave has this thing called mechanotransduction where it compresses a cell and then expands it. And a human or a mammal's cell membranes are so strong that it can withstand it. But the lipid, weak membrane of cancer, viruses, bacteria cannot withstand it. And they evaporate, they pulverize. So I think in the next 5-7 years, you're going to see SoftWave being used. Even though it's one of the contraindications now, I believe you'll see it in certain types of cancers where they're actually also trying to infuse the chemical drugs into tissue and cells. So that's number one. Number two, I'm super excited because in Europe, this has been approved for treating dementia, Alzheimer's, and traumatic brain injuries. So we have developed a post-concussion protocol through my doctors. I mean, that's a lot of NFL teams I work with are using that protocol. Tua, he's had 2 concussions in that one season, and some of my TikToks go viral every time he gets injured for some reason because of the algorithm. But I think I'm very excited about that. I mean, you know, we have one really cool case. I mean, you know, you meet cancer survivors every day, right? And not that we have it figured out, but we've improved the life expectancy of someone who's diagnosed. In fact, my wife, once she met that 10-year mark, she had now the same life expectancy as someone who never had cancer. That's pretty cool.
That's awesome.
But with Alzheimer's and dementia, and my mom's birthday was yesterday, and she passed away from dementia, and it's a terrible disease, right? And as Dale Bredesen says, you know, you don't meet dementia and Alzheimer's survivors. They die, right?
Yeah.
And, you know, I look at Dr. Michael Putnam out in Sacramento, California, and we worked together, and he used this on the first Alzheimer's patient that we know of. And what was cool about it is this guy, 71 years old, and for the last 2 years, he'd been nonverbal, couldn't feed himself, couldn't clean himself, you know, had difficulty walking. And we were lucky enough to work on him and see some amazing results. And this is the patient right here. His name is John. And
it's amazing. It's happy. We're happy.
Nice.
Do you notice the difference?
But that's John. And that's the first interview with someone who had full-blown dementia and Alzheimer's. So, I mean, we're not cleared for that yet, but we have compassion for them. And if people have, you know, family or friends that are suffering from that, I believe this could be a viable option.
Yeah, and that's super exciting. I'm actually excited about that. John, I know you've shared a lot of success stories, but can you share like your favorite success story of all time?
I think the coolest one is a guy, Frankie Smith, who came all the way down from New York City, who had neuropathy in his feet. He had worked for the Port Authority for years as a bus driver, 27 years. And the last 20 years, he had a stroke and his hand was like this. And he drove around New York City and the boroughs with one arm, basically, in hand. And that guy came down, and his daughter lived here in Atlanta. And so he was coming down visiting him for a week, and he came and he treated in our office every day. And his hand was like this. And I said, "What's wrong with your hand?" And he said, "Oh, I had a stroke, but I'm more worried about my feet." I go, "I'll fix your feet. We'll get your feet fixed, but I want to do this." And we did, first we did wrapped in a polychromatic light, and he had a little more movement. And then I did SoftWave on him, And over a 3.5, 4 minute treatment, I was able to open up his hands. And after the treatment, he was able to move his hand. And that was the first clip that got over 1 million views and really put me on the map as a progressive kind of innovator in healthcare. And that got me more stroke patients, and that got me more shoulder patients. That got me more knee patients. And it's helped drive other patients all around the country to more of our SoftWave providers. That was like the first big domino. And that patient, Frankie Smith, I'll never forget. And I still to this day will send him a note every once in a while. His hand still works. He had one dang treatment, and reversed 20 years. You know, I'm not the one that listens to doctors and said, you're never going to walk again, right? You'll never play lacrosse again. No, you have to be your own healthcare advocate. You have to go out there and search and find and interview. And yes, sometimes you have to go to doctor after doctor until you find the right one. But, you know, I will tell you, Dr. Mo, you putting this type of podcast together will help thousands of other people find and do research and be diligent about finding the top doctors that they want to work with. So I thank you for that. And thank you for giving us a platform to share this type of stuff.
Thank you for all the info. I got one last question for you before we head out here, but for any of the providers listening today, what advice would you give them about integrating SoftWave into their own clinics?
It's much easier than you think. And, you know, so many people are going to, how do I say this? They sit on the sideline. Right? If you've ever seen, there's a professor that says it's like a bell curve, and it's how any new technology is incorporated or implemented. And right now we're at the early side of this. We have only the pioneers and early adopters. And I think the people that are laggards are on the other side of it. They still have flip phones, right? But so many people, like they used to say to me, DiDuro, if this is as good as you say it is, why isn't it everywhere? Well, it's getting there. And it is as good as I say it is. So I think that's an important thing. I don't know if, maybe I could send this through our producer afterwards, but if they want to take a picture of that and then sign up for a call with me, that is the simplest way to get in touch with me. Even if you're just a patient and trying to find the top shock docs that have this, that might be a great way. So yeah, I think that's the next is really getting more people to try this, to experience it themselves. Because I think 9 out of 10 times people are going to be blown away with the results.
That's awesome. Well, Dr. Matt, thank you for sharing your expertise and passion for helping people heal naturally and effectively. SoftWave Therapy is clearly more than just a treatment. It's part of a new wave of regenerative medicine that's given patients real hope. And to our listeners, thank you for tuning in today at the Healing Wellness Show. And if you found today's conversation inspiring, be sure to subscribe and share it with someone who you think is going to benefit from this. So you can learn more. I know about Dr. Matt. We'll have his info on the screen, but you can learn more about Dr. Matt and his work at the Atlanta Pain Institute. That's, I think, atlpaininstitute.com. And follow the Healing Wellness Show for more insights on holistic and integrative healing approaches. Until next time, stay healthy, stay hopeful, and keep moving towards wellness. I'm Dr. Karim, your host, and thanks for joining us today.